Good morning. It's a pleasure to welcome you this morning to our annual HIDA Prevention Summit, part of a month of programming at the Office of National Drug Control Policy commemorating October as National Substance Use Prevention Month. My name is Shannon Kelly, and I'm the director of the National High Intensity Drug Trafficking Areas Program, known as HIDA. The HIDA program was created in Congress in 1988 and now has a presence in all 50 states, Puerto Rico, the U.S. Virgin Islands, and the District of Columbia. And we coordinate law enforcement efforts at all levels, federal, state, local, and tribal, to make our communities safer by reducing drug trafficking and production. HIDA's mission is law enforcement, but we accomplish that mission by investing in partnerships. Over the past decade, that investment has increasingly taken the shape of collaboration with public health partners. And while this may surprise some people who think we're only focused on arresting drug traffickers, for those of us in the HIDA program, this partnership has been a natural outgrowth of our desire to reduce drug use and its consequences across the United States. Advancing prevention at the community level requires an in-depth understanding of the opportunities created through public health and public safety collaborations. We partner with public health agencies and prevention experts because we share a goal and a mission. We all want America's citizens to be healthy, and we want our communities to be safe. Today, we will showcase the fine work being done at the national and regional level throughout the HIDA program and by many of our valued prevention partners. This summit also represents an opportunity for all of us to decide where to go next. Today's presentations will help inform all of us as we decide what approaches to invest in and what goals to set. Before I turn the microphone over to our HIDA Deputy Director, Jamie Delano, I want to thank her and our team of HIDA prevention experts for coordinating today's summit and gathering all of the experts to help us think about ways to approach prevention for maximum impact. I hope you all find today's summit informative, thought-provoking, and energizing. Thank you for your work to prevent drug use, and thank you for your partnership.
Thank you, Shannon. Thank you all for participating in today's annual HIDA Prevention Summit. We are pleased you could all be with us today virtually. The HIDA program has been extremely successful in achieving substantial impact on reducing the supply and demand of substances in our communities nationwide. Over the last few years, we have worked diligently to engage our public health sector partners to enhance our efforts, and we have paid special attention to preventing substance use in HIDA communities. One component of the HIDA public safety and public health framework is the HIDA prevention strategy that promotes and supports the integration of evidence-based and evidence-informed strategies to prevent and reduce substance use in our nation's communities. The HIDA prevention strategy functions as a catalyst for the development, implementation, and evaluation of prevention programming unique to the needs of HIDA communities. The strategy promotes the establishment of prevention strategies in all HIDA regions using the best available evidence to address the top priority needs within the HIDA. One resource funded to support the prevention strategy is ADAPT, which serves as a training and technical assistance provider to support all HIDA program substance use prevention efforts. ONDCP and the National HIDA Program are pleased to host the 5th annual HIDA Prevention Summit. Thanks again for joining us. I would like to now introduce Tom Carr, the Executive Director of the Washington-Baltimore HIDA, to speak about the value of the information that will be shared with you today to support your many individual and unique prevention efforts in your communities. Throughout his HIDA career, Dr. Carr has designed and implemented more than 150 drug task forces, 18 drug treatment, criminal justice, and 5 prevention initiatives. Please welcome Director Carr.
Thanks so much, Jamie, and good morning, everyone, and welcome to the 2022 HIDA Prevention Summit. My name is Tom Carr, and I'm the Executive Director of the Washington-Baltimore HIDA. Before I retired from the Maryland State Police and took this position, I often visited with kids in schools and spoke to them, their parents, teachers about drugs and crime. That's why I think today's focus on prevention communication is so important. Law enforcement representatives are respected by youth and play a unique role in their lives. They protect them and are responsible for keeping them and their communities safe. Today, perhaps more than ever, I recognize the opportunities we have to support our children in not using alcohol, tobacco, or other drugs. And all of these opportunities have a communications component. As one of 33 HIDAs across the United States, the Washington Baltimore HIDA funds 3 prevention programs designed to prevent substance use in youth by implementing multiple evidence-based strategies. Our focus on preventing substance use complements other Washington Baltimore HIDA initiatives, such as OD-MAP, which alerts communities when there's a spike in overdoses so they can respond to prevent additional overdoses. We believe a variety of strategies are needed to prevent substance use, treat substance use, and prevent overdoses. As a training and technical assistance provider for substance use prevention in HIDA communities, Washington Baltimore's HIDA's ADAPT has helped me and other HIDA directors better understand the evidence supporting numerous approaches. I still have much to learn. Today, I'm hoping and looking forward to diving into how I can integrate what we do know about prevention communications into the work of the Washington Baltimore HIDA. I want to thank Laura, Patty, and all of the ADAPT team for all they're doing to make HIDA better. And now it's my pleasure to introduce Dr. Laura Papard, who is the Director of ADAPT and Deputy Director for HIDA's Treatment and Prevention Programs. Thank you.
Thank you, Tom. Good morning, everyone. Welcome back. This is the 5th HIDA Prevention Summit, but it's the 3rd that ADAPT has hosted with the National HIDA Program Office. Really happy to see you all here today. We're going to start with a few housekeeping items. I understand that some of you may be having audio difficulties. If you are, make sure that the audio in your event lobby is muted. And when you are in session, then you can turn that volume on, and that may help some of you. Let's start with just how to navigate your Zoom platform here. We are working with Zoom events for this particular summit. When you logged in from your ticket, you arrived at an event lobby. Up at the top on your tabs, you will see a sessions tab. When you click on that, as you all have done, if you are seeing me here today, all of your sessions are available to you there. And what I'd like to point out is within each session, you will have reference materials. Those reference materials include bios of your speakers, slides from those speakers, and any resources that they recommend. You also will have a complete resource supplement for the summit, and so that will all be available to you underneath your specific session slides. I'd also like to point out that there are 2 features at the bottom of your screen. There is a chat feature and there's a Q&A feature, which many of you have already started to use, which is wonderful. The chat feature comes straight to our ADAPT team here behind the scenes. If you have questions about anything that's happening for you technically, then please reach out to us and via the chat box, and we will try to resolve that for you or give you some guidance. The Q&A box is the one where you can actually insert questions for our speakers. And as your guide throughout the summit today, I'll be coming up and offering those questions to our presenters. I also wanted to cover that evaluations will be given during each session. At the conclusion of each session, that will happen automatically when you close out your box, as long as you stay towards the end of that particular session. If you'd like continuing education credits, that's the way to do it. And you will also receive another full summit evaluation. Please complete this. It will be coming to you via email at the conclusion of the summit. We really use that feedback to guide a lot of our products and services moving forward. In terms of certificates, your CE certificate will be issued to you as you complete the evaluations for each session. It may take a couple days to get those to you, but you will receive those. You also, if you have not received them by the end of next week, please let us know, but we are pretty good about getting those out either tomorrow or the beginning of next week. So for those of you that need CEs, be aware of that. You will also receive a participation certificate if you complete the evaluations, because we understand some community members need evidence of their participation in today's summit for their work. All right, moving on. For the mission of ADAPT, I think it's important for you all to know what we do, right? And our mission is to advance knowledge, skills, and quality outcomes in the field of substance use prevention while supporting that successful integration of strategies informed by, as Jamie mentioned earlier, the best available evidence into our HIDA communities. In order to achieve that, our primary goal is to deliver training and technical assistance services, and we offer those services in a variety of domains. Those services have informed why we're here today, and I wanted to take you on a 1-minute journey of our activities over the last year. It all started back in April of last year when we started receiving technical assistance requests from a variety of HIDA communities across the nation. Those included local requests as well as state level requests for assistance in developing prevention communications across a multitude of causes, right, and stages of use. What we did is we fielded a lot of those technical assistance requests with individual consultation with communication science experts in the field. And then last October, for those of you that attended our annual summit exactly a year ago, we invited Dr. Nat Kendall Taylor from the Frameworks Institute to help us get a starting point with thinking through, okay, what is this framing business? And can you share and tease apart a little bit of how we might start adapting a framing approach into our prevention communications? Well, that particular presentation was extremely well received, and on the evaluation, we heard from all of you that you were hungry for more information on this. And so what we did is we offered a campaign at the beginning of the year on prevention communications. That campaign was an 8-week campaign. It was via social media and email, also included 3 workshops, as well as a bonus workshop because you all wanted a social media focus as well. But that still wasn't enough. And so what we did, the technical assistance requests kept coming in. So what we did is we formed a HIDA Prevention Communications Council comprised of multiple federal partners and content experts in this field. That council went live at the beginning of this year, and that has led us to where we are today. Today, we will be delivering you and equipping you with an actual toolkit that will help you think through this entire concept and give you a nice firm starting point for this. Our goal throughout this summit is to help you launch some type of approach, whether it's individually in your conversations with youth or whether it's mass communications campaigns, right? Our goal is to equip you with the knowledge and skills to prevent, onset, or escalation of substance use in youth aged 12 to 18. That is why we're here today. I'd also like to note that next summer, we're going one step beyond this, and beyond the toolkit, we're also preparing a micro-credential for those of you that are serious about really wanting to develop competence in this area. That will be available to you next summer. So what can you expect from today's summit? Well, you can expect updates as you always get them every year on national drug priorities and advances in our field of substance use prevention science. We're going to inspire you and motivate you and provide a framework for solving problems before they happen with our keynote speaker. We also then are going to provide a summary of, as Jamie mentioned, the best available evidence out there to give you that solid starting point on substance use prevention communications. We'll provide the toolkit and ideas from various roles such as public safety, healthcare providers, educators, caregivers, and prevention professionals, including coalitions, to help get you started as well. We've brought them here today. And finally, we're going to issue a call to action. Actually, I'm going to issue it right now. The title of today's summit was Mind the Message, and that is the title of our call to action. And really what we'd like to do is we've designed the entire data to support you in your substance use prevention communications and integrate the best available evidence into your communications with youth. We have 4 steps to help you with that call to action. Pledge is our first step. Go to the website. We are uploading a document into the chat box. You will be able to access that. Click on the link. Pledge to communicate with youth about substance use prevention using evidence-informed strategies. Learn one positive social norm. You're going to learn exactly what I'm talking about with that phrase over the course of the day. Use it just once. Try it. Use that positive frame and repeat over and over again. The message of the positive norm needs to get out there, and share this call to action with others who you interact with, especially youth, 12 to 18, right? We all play a role in this, and we can do this together. With that, I am going to hand it over to Jamie to introduce our opening speaker.
Thank you, Laura. And now it is my distinct pleasure to introduce Dr. Raul Gupta, Director of the National Drug Control Policy and a champion of the HIDA program, and all of your efforts to combat drug trafficking and safeguard our nation's communities from the negative consequences of illicit drug use. Dr. Gupta is the first physician to lead this office. He has previously served in leadership roles at the local and state levels in West Virginia, where he worked closely with Appalachia HIDA to reduce overdoses in the state. He's a champion for the HIDA program and its work to punish drug traffickers and make sure people with addiction get the help they need. Please welcome Dr. Gupta.
Thank you, Jamie, for that introduction, and good morning, everyone. And thank you really to the Washington Baltimore HIDA and the ADAPT team for hosting this event with ONDCP and the National HIDA program. We really appreciate this. Thanks for everyone who's tuning in today. You know, President Biden has declared October as the National Youth Substance Use Prevention Month. It's really important because preventing substance use is a vital part of our comprehensive approach to addressing the overdose epidemic, confronting our nation's communities, and the president pretty much has called for us to come together and beat the overdose epidemic, so it's really important. You know, we know that preventing youth substance use before it begins will help us in preventing overdose deaths in the future, so this is an investment. And right now, we need to support prevention more than ever before. And you might wonder why. I think you know the answer. I don't have to tell you that, you know, over a 1 year period, we've lost more than 108,000 people to a drug overdose, with almost 80% of them attributed to a synthetic opioid like fentanyl or its analogs. Now, that's an American citizen dying of a drug poisoning every 5 minutes around the clock, every hour, every day. And these people are not just statistics. They're sons and daughters, their parents, friends, the neighbors, their loved ones that are not coming home. They're not going to be at the dinner table. They're not going to be there for birthdays or holidays. So if you think about it, the cost of this epidemic is so real. Now, you know, why is this happening now, and why is this such an urgent priority for us at the White House and for President Biden especially? Well, because we're right now in the most dynamic drug supply environment in our nation's history. You know, we're seeing increase in overdoses from synthetic opioids like fentanyl, but also meth and cocaine. And it's important to recognize how the drug environment is changing. And I'm sure you've all seen this, the days that in the past, a large volume production of plant-based drugs, carrying around tons of material, they're fading, and a smaller volume, more lethal synthetic drugs production is rising. And this has really opened the Pandora's box. In fact, that the synthetic opioids that are killing Americans, mostly fentanyl and its analogs, we know that they're manufactured outside of the United States and are brought across our borders and into our communities by a variety of means. Now, these substances ultimately infiltrate our most vulnerable communities. And that's primarily what's leading to overdose deaths and unintentional drug poisonings among the youth. So it's so absolutely critical that we take action. And this is what I wanted to talk to you about today. You know, we are taking that action. In his State of the Union speech, President Biden announced his unity agenda for the nation earlier this year. And the first part of that was beating the overdose epidemic. And here at the Office of National Drug Control Policy, we're working hard to stop this, you know, what I call death and destruction, and help people through evidence-based prevention, treatment, harm reduction, and recovery services. Now, earlier this year in April, President released his National Drug Control Strategy, which lays out the federal government's plan for reducing drug use, overdose deaths, and drug trafficking. Now, there are four key actions I want to just mention very quickly to you that can save lives right now from overdose. First, we've got to make sure that we're getting access to naloxone, often people call Narcan, which is basically an antagonist, overdose reversal drug for opioids. And we know that 3 out of 4 people that are dying from overdose are because of opioids, and getting this into the hands of everybody without fear of judgment will help us save tons of lives. We also want to make sure that those folks, we are able to connect with treatment. And we don't have enough treatment as it is, and we're trying to, and working hard to expand treatment. We also, thirdly, want to go after the drug traffickers' profits and their operations. And fourth, we want to improve data collection so we can use that knowledge to better help save lives, because so many people go through non-fatal overdose or addiction that we don't even know about in such a way. Now, the president's strategy also directs federal agencies to expand our work to prevent youth substance use. It's really important. There's so many factors at play that influence the mental and the emotional and the behavioral health of kids, children, and adolescents. Now, we know for the, our strategy adds things like adverse childhood experiences and why that's important to address, because from housing to poverty to stigma to transportation and so many more things, it's important to address all of these things. But the good news is that research now shows us that evidence-based prevention interventions can have really good and positive long-term effects and reduce drug use. So the president's strategy is going to help us, and it's going to help the K-12 schools to increase the reach of and access to substance use prevention supports and services. Now, a lot of this work is already going on and underway. In a long time, I'm so proud to say that the office here at ONDCP and Department of Education are now hosting a series of webinars for school district officials all over the country about relationship between mental health and substance use, what we call co-occurring disorders. And we've been increasing support for drug-free communities support program, which is leading the way in this, along with other evidence-based approaches. The HIDAs have a long track record of working with DFC coalitions to prevent youth substance use. And that's what brings us together today, to really talk about how each of our HIDAs is making a difference for their own communities and how you can do even more to prevent youth substance use. Now, here at the White House, we're prioritizing efforts to strengthen local law enforcement cooperation, and I'm working to provide the tools that will help you to be successful. Early in April this year, we announced the $275 million in funding for our HIDA areas. And, it also funds Indiana HIDA and the other 32 HIDAs across the nation. And just last month, a couple of weeks ago, we announced an additional $12 million to help law enforcement reduce violence through the Crime Gun Intelligence Initiative, as well as prevent substance use and reduce overdoses and target illicit finance. I was in New York recently, and I got to see some of the work that happens and hear some of the work through the CJICs, able to reduce the backlog and really take smart approaches to addressing gun violence. And that's really where we need to be. I'm so happy that we were able to do that. Now, that HIDA's program plays a unique role in substance use prevention because it brings together law enforcement and prevention experts within the nation's communities. That is so important to make sure that we're working collectively and together. And that is a real strength across this country. And we have so many ongoing collaborative efforts taking place every single day between law enforcement and community-based drug use prevention programs, because they are vital. The collaboration and the work collectively is so critical and vital to making sure we get prevention out there. Now, I want to mention, in his proclamation, President Biden pointed out that preventing substance use during adolescence has been shown to significantly reduce the chance of developing a substance use disorder later in life. In fact, for every dollar we spend today on effective school-based prevention programs, we save $18 in future by avoiding potential medical costs and boosting productivity on the job. So this is not just about prevention. It's about cost savings. It's about getting more productivity and workforce across the nation. So supporting prevention is a win-win for our country. And in support of the Biden-Harris administration's drug policy priorities, the HIDA program has made a substantial investment in supporting prevention activity. And we're so happy and excited about that. Just this year, 17 HIDAs invested nearly $5 million to support local and regional efforts to reduce drug use. Now, to support these great efforts, our HIDA program also developed the public health, public safety framework to highlight and synergize the continuous efforts of essential partners while we're synchronizing public health and public safety programs and initiatives. Really critical, as I talk about all the time, to be able to work at the intersection of public health and public safety. And through this vital framework, the National HIDA program, it really bolsters 5 key initiatives in support of drug prevention, treatment, and recovery, and ultimately reducing the availability of illicit drugs in our nation's communities. I'll mention these quickly, the 5 initiatives. 1, the ODMAPS program, the Overdose Detection Mapping Application Program. 2nd, distribution and training on the use of naloxone or Narcan. 3rd, the National Marijuana Initiative, something that I've been briefed on and really great work happening. 4th is the overdose response strategy that is also so critical and vital. And 5th is the HIDA National Prevention Strategy. Now, this strategy serves as an infrastructure for guiding the existing prevention programming, as well as nurturing new growth and development in prevention in HIDA communities. The strategy has 3 simple but powerful goals. Establish prevention strategies in all HIDA regions. Secondly, use assessments and research to guide prevention efforts. And thirdly, to sustain prevention strategies in all HIDA regions. Now, some of the many programs and approaches supported by HIDA prevention strategy are going to be showcased here today, and I'm so excited to learn about those. Preventing drug use is really a whole of government effort, but it also requires the presence of our partners and then across communities and commitment to this mission. So thank you so much. Thank you for all you do every day to overcome the unprecedented threats posed by opioids, meth, cocaine, and other deadly drugs. And thank you for being leaders in your communities. We all have a really important role to play in preventing overdoses, and our nation's youth are counting on you to help keep them safe, because they are the future for our nation. Please feel free to reach out to Shannon Kelly in our office, or Jamie Delano. They are some of the best parts of the team in this office and part of our HIDA team. So if anything we can help with, please let us know. So thank you, and have a great day.
Thank you, Dr. Gupta. All right. At this time, just a few quick updates. Number 1, if you are still having audio difficulties, I've been told that the event records from the lobby. So if you're having difficulties, make sure that you stop that recording when you enter the session. Our next session will occur today at 9:20, and you will be meeting our Hawaii HIDA team. So throughout the day, all of our intros have been recorded by HIDAs across the U.S. Different representatives, HIDA prevention coordinators, drug intelligence officers, public health analysts. We even have a National Guard counter drug representative here today. So you'll get to meet kind of the whole team and who does that power work behind the scenes. So at this point, I want to thank you for joining us. Welcome to the HIDA Prevention Summit, and we will see you at 9:20 in the next session. So close this out. You'll have an evaluation, and we'll see you on the other side in the session with Dr. Carlos Blanco, so that we can hear about the state of the science. currently. See you there.
Like the sunshine comes after rain, like the happiness after the pain. Got a good thing coming my way, coming all day, coming to me like. Gotta check that sign with my name, and a future I gotta claim. Got a good thing coming my way, coming all day, coming to me like. Good things follow,